Each year in the UK, there are around 2,500 cases of bacterial meningitis and about 5,000 cases of viral meningitis. Effective vaccines are available and given to most babies and young children, but there is no vaccine currently available to protect against the most common type of bacterial meningitis in the UK, caused by the meningococcal group B bacteria. This bacteria can cause meningitis and septicemia. It is vital that everybody knows the signs and symptoms of both meningitis and septicemia and the action that should be taken. Meningitis is the inflammation of the layers of membrane that surround and protect the brain and part of the spinal cord. Septicemia is blood poisoning. Meningitis and septicemia can happen together. Be aware of all the signs and symptoms. Someone with meningitis or septicemia can become worse very quickly, so keep checking their condition. Trust your instincts. If you're at all worried that somebody may have either of these diseases, get medical attention immediately. Both meningitis and septicemia can be difficult to diagnose in the early stages. Early symptoms can include fever, headache, nausea and muscle pains, and these symptoms can mimic more common everyday illnesses such as a cold or a flu. It is therefore important that everybody knows all the signs and symptoms and what action to take if they're worried about somebody's condition. The more specific signs of meningitis and septicemia are temperature with cold hands and feet, drowsy, difficult to wake someone, confusion and irritability, severe muscle pain, a pale blotchy skin with spots or a rash, severe headache, neck stiffness, dislike of bright lights, convulsions or seizures. Other symptoms to look for in young babies, which could also indicate meningitis or septicemia, include the baby becoming fretful and not like being handled. They may be floppy and unresponsive. Their breathing may become rapid and they may make a grunting noise. They may have an unusual cry or a moan. They may have a tense and bulging fontanelle, which is a soft spot at the top of their heads. A rash that does not fade under pressure, when a clear drinking glass is pressed firmly against the skin, can be one sign of septicemia. However, it is really important to remember that not everybody will get a rash, or the rash may appear as a late sign. It is really important to remember that not everybody will get a rash. If somebody's condition gets worse, do not wait for a rash. It can appear late and sometimes will not appear at all. The rash may also fade at first, so keep checking. A fever with a rash that does not fade under pressure is a medical emergency. And also the rash can be more difficult to see on darker skin, so check paler areas. Trust your instincts. If you suspect someone may have meningitis or septicemia, get them seen immediately. You can call NHS Direct or your GP. You can take somebody to your nearest accident emergency department, or you can call 999. Make sure you describe the symptoms and say that you think it might be meningitis or septicemia. Remember, early diagnosis can be difficult. If you've already sought medical advice and you're still worried about somebody's condition, do not be afraid to go back and get them seen again. Don't forget, meningitis and septicemia often happen together. You need to know all the signs and symptoms. Symptoms can appear in any order and some may not appear at all. Don't wait for the rash. Someone with meningitis or septicemia can get a lot worse very quickly. Keep checking them and trust your instincts. Get medical help immediately. If you'd like more information, visit our website at www.meningitis-trust.org.